Hello, ladies and gentlemen. Welcome to today's tutoring session. I'm your host and NCLEX tutor, Annalise Garrison. And today, some of us have forgotten how to write a nursing diagnosis, so I'm going to teach you the components of a nursing diagnosis. We want to take our recognized cues, the things that are important in the question. We're going to analyze those cues, and then we're going to come up with the prioritized hypothesis. Prioritized hypothesis in this case means to write a nursing diagnosis, and that's what I'm going to teach you this morning. So let's look at the components of writing a nursing diagnosis. And for our question, we want to pick the priority nursing diagnosis, not all the diagnoses together. But I can't go on teaching you because some of us forgot how to write a nursing diagnosis. So let's tackle that first. So just to review, what is a nursing diagnosis? A nursing diagnosis is simply a nursing statement about what is going on with your patient at any given time. So we, in our tutoring sessions, will arrive at the nursing diagnosis by using the steps 1 and 2, recognizing and analyzing cues of the clinical judgment model, right? And in fact, our nursing diagnosis will be step 3, the prioritized hypothesis. That will be our nursing diagnosis. Once we have accomplished steps 1, 2, and 3 of our clinical judgment model, then and only then can we go to steps 4, generate solutions, step 5, take action, or step 6, evaluate outcomes of the clinical judgment model, which is what most of our questions is asking us to do. Most of your questions will ask you to generate solutions, take action, or evaluate outcomes. But in order to answer our questions, we have to understand the clinical judgment model and the nursing diagnosis part. So, what are the components of a nursing diagnosis? So, the 3 components of a nursing diagnosis is the problem, the cause is the second component, and the third component is as evidenced by. The problem is going to be our words that the NANDA approved nursing diagnosis, right? The cause is going to be the cues that you picked out of your question, and as evidenced by is going to be what brought them to the hospital, or what, the evidence, right? What brought them, why are they having shortness of breath? So I guess the evidence by would be the why. So the problem is our NANDA approved nursing diagnosis. The cause is our cues, and the as evidenced by is the why in this case. So let's look at some questions. I just got done a tutoring session, and I just want to say this before I move on. If the NCLEX is asking you to pick a proper diagnosis, the priority diagnosis, to actually pick that for the answer, you want to pick, remember, your diagnoses can be long-term goals or short-term goals. You want to pick the diagnosis that focuses on the short-term goal, right? You always want to pick the acute. You always want to pick the short-term goal. You always want to pick the immediate problem, not the long-term problem, not the long-term goal, not the long-term diagnosis, the short-term diagnosis, okay? Now, the first step, according to the NCSBM clinical judgment model, is to recognize cues. So let's read this question. A middle-aged client who has smoked 2 packs of cigarettes a day for the past 10 years is admitted with a diagnosis of lung cancer. The client reports having no appetite and exhibits symptoms of anorexia. The client is 5 feet 8 inches tall and weighs 112 pounds. The client is now scheduled for a left lung lobectomy. The nurse should include which factor when planning to prevent post-operative pulmonary complications. So what are the cues in this question? Second step in the clinical judgment model is to analyze the cues. Now, are all these cues important in our answering the question? And it is at this time you can look at the answers to see which direction the answers are going in, but please don't answer yet. Please make your nursing diagnosis. And we can see here that we have two possible nursing diagnoses, right? Inadequate nutrition, possibly, and inadequate air exchange or impaired gas exchange. But which diagnosis are we going to use? What exactly is the problem? So keep those two diagnoses in mind: impaired gas exchange and inadequate nutrition. But we can see that we only have enough information, to do the inadequate nutrition, right? We can't do impaired gas exchange. Although this person smokes 2 packs of cigarettes a day, there's not enough information in the question to use the diagnosis of impaired gas exchange. But we do have more information on her inadequate nutrition because we can see no appetite, weighs 112. That's small. That's a small amount for her weight and height and her age. She's showing signs of anorexia. So let's go with the diagnosis of inadequate nutrition. So the point of the nursing diagnosis, we start with the problem. What is the problem? What is the immediate problem? Always focus on your client. I always tell you that when I'm tutoring. Focus on your client. What is your client reporting? This takes priority when you're figuring out your nursing diagnosis. The second part of a nursing diagnosis is the cause. What is the cause of this person's inadequate nutrition? Well, she reports no appetite, and it could possibly the cigarettes could play a part in this with the taste sensation. We don't know, but definitely the no appetite for sure. So the second part of a nursing diagnosis: first part, problem; second part, cause. The third part of a diagnosis is the as evidenced by. What is your evidence that this cause is happening, right? In this particular case, the woman is middle-aged. She has low weight, secondary to lung cancer, right? So how do we write this nursing diagnosis? How do we put it all together? The problem, the cause, and the as evidenced by, the evidence. So, in the end, this is the way our nursing diagnosis would read for this question. Inadequate nutrition, that's the problem. Related to no appetite, that is the cause. As evidenced by less than normal weight for age, that is the evidence. Now, when I am tutoring you, you cannot use medical diagnoses in your nursing diagnosis, but I want you to if the question says cancer or diabetes or whatever, right? So, for the purpose of tutoring only, I want you to write secondary to lung cancer and symptoms of anorexia. Secondary to cancer. You can use a medical diagnosis if you say secondary to. So there you have it. Now, why couldn't we use impaired gas exchange? Because there was not all three of these components in our diagnosis of impaired gas exchange. Let's look at that nursing diagnosis. So in this one we have impaired gas exchange, that's the problem, related to smoking 2 packs of cigarettes a day, that is the cause, but there's no evidence. She's not having shortness of breath. There's nothing to support this problem in the question. Whereas with the nutrition, there was a problem, there was a cause, and there was evidence. In the impaired gas exchange, there is not. So therefore, we would go with the nutrition. Besides that, the patient is reporting no appetite, right? So when you answer your NCLEX questions, when you recognize the cues, analyze the cues, always focus on the client and then focus on the question. So in this case, we're going to focus on the pulmonary complication. Secondary. First, we're going to focus on our client. No appetite. Always focus on the client, then whatever the question is asking. And then, if you do that, you will be able to prioritize hypothesis. That's what we're doing. We're prioritizing our nursing diagnosis in this case. Prioritize hypothesis is the third step in the NCSBN critical thinking judgment model. This is what I am teaching you. Okay? So I have a tutoring session right now. You all have a wonderful day. God bless you all. And I will see you in the next video. If you need help with the tutoring, call me today. I'll put the information here.